Hello, my name is Dr. Chiadza, and I am here today with another series of questions with specialties. We are
All right.
here today with a cardiosurgeon representing for us.
Yay! Right.
Would you like to introduce yourself?
Okay, so I'm Dr. Okaiko Okanti, and I'm a cardiac surgery resident in the University Hospital Ostrava in the Czech Republic. Um, yeah, that's me.
Okay,
Little
well,
overview.
perfect. We're
Yeah,
gonna dig into you and your specialty with a few questions.
right.
So firstly, why did you choose to go into cardiosurgery?
Okay, so I have always wanted to do cardiac surgery since I was 9. My dad underwent like a cardiac surgery. And I remember that there was a time in Ghana where we didn't have a lot of surgeons. So I remember that they were having difficulties not finding somebody, but the cardiac surgery rosters were not like, functioning the way they should have. And my dad had surgery, and I told myself I could do that. If they're having like problems finding somebody, I could do that too.
Mm.
So I remember that I wanted to go into medicine mainly because I wanted to be a cardiac surgeon because of the experience my dad had when they were trying to find someone to do, the surgery for him. So that's my story. Like I've always wanted to do it since I was 9.
Oh, and you had the same vision all the way up to medical school. You knew throughout. You never changed.
Yes. Okay, I'll admit that I was a little bit biased. So
Mm.
I wanted to do cardiac surgery, but I did give other specialties a chance. And I realized that I wanted to work more with my hands than to do, I mean, internal medicine, there's loads to do with your hands and everything. But I think in surgery, it's more of a hands-on approach. I think it's more, I liked more of the action. My mom always says that she knew that I was going to do something like this because she
Mm.
was like, when I was little, I was always like fidgeting with stuff and trying to destroy stuff and build them up and everything. So she was like, I knew that if you went into medicine, you would do something with your hands, like something
Mm.
surgery, based. So I gave other specialties a chance, and I was still in love with cardiac surgery. So
Mm.
yeah.
Love that for you. So, how long have
Yeah.
you been working in cardiosurgery for?
Since 2017. But I was working like as a normal doctor, but then in the Czech Republic, you usually have to do like a registration or you have to officially announce that you're going to do cardiac surgery.
Mm.
So I did that, I think, a year after. So my residency started a year after I started doing cardiac surgery.
Mm.
So since 2017.
Yeah. And how long does it take for somebody to reach consultancy level in cardiosurgery?
It's a minimum of 7 years in the Czech Republic. But the thing is that there's so many things affecting your residency. Like
Mm.
there's a list of procedures you're supposed to finish,
Mm.
and you have to get that before you go. And since we had COVID and other things, we
Mm.
slashed the number of surgeries, planned surgeries, into like half. So
Mm.
that affected like the timelines of everything. But what I've realized in medicine is that it's really not a race. Once
Mm.
you're doing what you love, the rest of it is like exams. And you do want to do your exams and you want to get everything done,
Mm.
but it's not if you give yourself timelines,
Mm.
that's great, but you should be prepared that you will not meet those timelines, not because you're not
Mm.
trying, but because there's other things that are like affecting,
Yeah.
these things, and you shouldn't be too hard on yourself. So
Yeah.
it's a minimum of 7 years, and it will probably take longer because of, other factors, but it is a minimum of 7 years. And I think it's a lot, but that's the rule. And if it takes longer, we're
Yeah.
here in the trenches.
Yeah.
We're gonna
That's
do
so
it.
that's so true because I actually know a lot of
Yeah.
people that have said that they want to do medicine, but it just takes so long to get into to become a consultant. But you also need to
Yes.
take into consideration that you're working this whole
Yeah.
time after you finish
Yeah.
medical school. So it's not like you're just studying, you're studying while you're working, and
While we're
consultancy
working.
is like the highest in your field.
Yeah. You
So
know what? I think the problem with people is that they want the title or they want to reach that,
Mm,
milestone, which is great because it's like a goal.
yeah.
But the thing is you have to enjoy the journey
Mm,
as well. If you're focused on the goal, that's great. But the journey, there's so much more to learn on the journey. And if you don't get there at the time you set for yourself, it's not a failure. You're still a work in progress.
yeah.
So I think that people should be like more, not more relaxed, but to understand that the titles are great, but the journey is more
Mm,
important because the journey is what you learn to get there.
yeah.
So
Yeah.
it takes as long as it takes, and it's great to have a goal, but it's also great to realize that I'm doing this in this way, and I'm on a path and
Mm,
I'm following it. So I will get there.
yeah.
Maybe not in the time I plan, but I'm working there towards the goal to get there. So
Yeah.
yeah.
Um, Next question. What do you love most about cardio surgery?
Um, I don't want to say the adrenaline because that's weird. What do
Is
I
it
love
true?
about cardiac? Yeah. Well, that is one part of it, but the
Mm,
thing about cardiac surgery is that I consider that a specialty.
mm,
And someone asked me, why not neurosurgery? And I said, for cardiac surgery with the heart, we could do so many other tricks
mm,
to stall, to
mm,
get a patient healthy. But in a field like neurosurgery, if it's out, it's out. Like
mm,
well, the brain is the brain, and if it's gone, it's gone. The spinal
mm,
cord is spinal cord, and if something happens, then that's it.
yeah.
No, well, not totally, but I've one thing I love about cardiac surgery is like the new innovations that come with it. It's a very interesting field. You learn so much. It's more skill based, and when you get that aspect, you realize that you see your results immediately.
Yeah.
It's it's very it's more, I don't know how to describe it, but it's more of they're always inventing new things in cardiac surgery. Things are changing. You have to always update your information.
Mm,
So I really love the fact that it's innovative, it's interesting. There's always this adrenaline rush in
mm,
surgery. Of course, if we have like a very tasking surgery, a very risky surgery, it's not so fun for any of us because it's going to take hours and hours to finish.
mm,
But I mean, it's great at the end of the day, a patient comes in and
mm,
it's a great feeling knowing that the team effort that we, put in is,
mm,
helping a patient, and you see the results almost immediately.
yeah.
And then as time goes on, in a few months, you see a vast improvement
Mm,
in what you saw, the deterioration, and then the immediate results, and then how it improves. So
mm,
I think I like that aspect of cardiac surgery.
mm. Right. And for prospective students and doctors, why would you say that somebody should go into cardio surgery, and also why should somebody not go into
The
cardiac?
cardiac surgery. I'll tell you what we have been told.
Mm,
Most of the time, they say that women generally shouldn't go into the surgical field because it's demanding,
mm,
and you are supposed to pick a more relaxed field where you can have family time, and
mm,
you'll have you know your kids and everything. But one thing I would say about cardiac surgery is that it's not a gender-based field. It's more of, if you have the passion to do it, just go into it.
mm,
Like I said before, you see your results immediately.
mm,
And it is the downside of cardiac surgery is that it's very demanding. It's time demanding, it's time consuming. It is physically, mentally, emotionally sometimes very difficult. But like I said, if you have a passion for it
mm,
and you have the skill, there is no, like, you shouldn't wait for someone to tell you that you can't do it and you cannot do it. It's a very, very interesting field where you know, there's a sense of fulfillment after you have done a surgery, or there's a sense, even in the wards, there's a sense of fulfillment when you kind of show a patient that everything is going to be okay. Sometimes that things are going to not go south, but it's a risky patient, there's a sense of fulfillment knowing that you could do something to help a patient in this regard, or you talk to assure the family members of the patient that this is how it's going to be. And if this doesn't work out, we're going to do it this way. It's just the sense of fulfillment. If you have the passion for it, you're always going to be fulfilled.
Yeah.
And if you don't, it's going to be really hard for you. The downside of it is, of course, that it's very time demanding. And for women, especially, you have to find a partner who understands that this is what you do. And so far, there's just been women residents in our department. So I cannot say that we have like a template of what a woman should do in cardiac surgery and what she shouldn't do. I'm pretty sure there's other cardiac surgeons who will explain how they've balanced, work and family. But I think that the downside is just that it's physically and emotionally draining. And if you're not passionate about it, you would feel like you would be miserable. So the passion for it outweighs the downside to it.
Yeah.
I would say.
Yeah. And also just to touch more on that, like gender bias, because even when I was in medical school, and I'm sure a lot of people had it, like every time I would be in the theater or surgical rotations, typically male surgeons will be like, don't go, if you're a woman, don't do surgery. It's not for you. You should pick something more family friendly with time. Every time it was GP that was suggested, or internal even as well.
Yeah.
What do you feel like you had to overcome any barriers based on your gender, but also your race, because you're Black in a predominantly white area? Do you feel like you had to like overprove yourself, or do you think
Yeah.
that it would be the same regardless?
With that statement about, pick something more family friendly, it's weird to me because these men also have families. And so if it's not so family friendly, you're doing it. And are you saying that you don't spend enough time with your family? That's
Which
really
is a
weird.
problem.
Yeah, exactly. So when like they've said all of those things before, and what I would say is that it's demanding. Every job is demanding for everybody, but then you consciously make time for the people that you love and the things that you love to do. The fact that you do something doesn't mean that you cannot have a hobby. The fact that you do something, that it doesn't mean that you cannot have like a family, or you're not going to spend more time with your family. We've heard that so many times. But the weird aspect is the fact that the women, from what I have gathered, work harder than these men. And then they like it, they feel like they are skilled. So I feel personally that it is I don't know, it's a feeling of, I don't know if they feel threatened by the fact that they're women doing it, because we are learning your skills. So maybe you feel like they would be better than you. And another thing is that, especially in cardiac surgery, they feel like it's such a huge field that we should be afraid of it. And the fact that they see women doing it and not being afraid scares them. And I feel like they ask themselves, so why aren't they afraid? Because maybe on their level, or when they were on our level, they were scared, but we don't exhibit that kind of fear. And maybe we should, but we don't see a reason to now.
We don't need to.
I don't listen. What anyone has to say about what you feel or what you're passionate about is their problem. So if I'm passionate about doing neurosurgery, I'm going to do it because we are women. We figure things out. So we are faced with a challenge and we figure it out. The only way you know that you're not going to do it is if you don't try. So yes, I'm a woman. I'm doing cardiac surgery. When I have kids, I will go home on maternity leave and I will come back. We figure things out. That's what we do. So I wouldn't, if somebody, for women especially who want to go into surgical fields, I would say that whatever the men's opinion about you is their problem. And like I keep saying all the time, you'll figure it out when you get there. It's good to have a plan, but we always figure things out.
Yeah.
So I don't believe that any field in medicine is gender based. And also there are more women going to medical school than men. If you
Really?
look at the percentage of women going to medical school, especially in the Czech Republic, when we have a group, medical students in a group, we realize that there's more women than men. So if you restrict certain fields to gender, then you're saying all the men who go into medical school should all go into surgery.
Yeah.
Which is not the case, because now most of them like to go into more relaxed fields like general practitioners and the internal fields where you can have your own consultancy, and then you can see patients in your own time. So then who's going to do the job? Who's going to do surgery?
Yeah.
Then if there's more men and more female than male going to medical school. So it's when they say these things, it's just background noise to me. So you can have your opinion, but I'm going to do what I feel like I can do. And I'm going to give it my all. And to touch on the fact that you asked about being like a Black person and predominantly white
Black woman in surgery.
establishment.
Yeah,
Yes.
two barriers to. Do you feel that there are any barriers, or do you think it's just stereotypical?
I try not to see barriers. Sometimes you have to ignore certain things. It's not a secret, or it's not unusual that they're not used to working with different people. They're used to working with foreigners, but not someone who is ethnically so far apart from them. So I'm blessed to have a boss who is open-minded, who has worked with people from different races in the US. So he kind of encourages me all the time. If there's something I need to improve, he's there to tell me what to do and how to do it. And so, but it has been quite difficult integrating into the system. And no matter how much you try, you're different. So there have been barriers, like you can't say you had the same opportunities as, say, the other people in the department. You can't say that. I mean, they try to be fair. My boss tries to be fair, but everything depends individually on each consultant. And so I would say that I have had some opportunities, but I cannot say truthfully that I've had the same opportunities as other people. Yeah, but it's not something that should deter you or pull you down. I mean, we're human. We have those days where we break down and but you have to pick yourself back up. It's okay. It's okay. You break down and then you pick yourself back up, and then you try and work on yourself. And a lot of people have a lot of things to say, but if those people's opinions, you don't really respect those people's opinions, then I don't think it should bother you. Sometimes it does, but then it should happen 5% of the time, and 95% of the time you need to pick yourself up and keep working. Yeah.
I think people are easily deterred, even like in terms of medicine in general, because it sounds like it's so hard and it's so long, and then maybe going yeah, it is long and it is hard, but you figure it out, like you said. And even like going to a lot of people didn't want to go abroad because they just felt like, do I want it this much? Like it seems too hard, but you figure everything out as you go along. Things are never as bad as they seem from afar. So yeah, that's very powerful. And not only are you a cardiosurgeon, you're about to have a PhD as well. So
I'm working on that with all
it.
my heart. Like that is a nightmare, but it's there's so much to do with that respect. Like so in the Czech Republic, if you work in the university hospital, you realize that your bosses always want you to go into research and do like a PhD, because it's the university hospital, and we are supposed to come out with all these researches that prove this and that and that. So so that is it's a hard thing. It's not easy, as some people think that it's more of going into you do your research, but you're also trying to make publications and everything. It's time consuming. And most of the time you just want to pull your hair out. But it's it's actually I don't know, I realized that I liked the like doing my articles and everything. The only problem with article writing is the pressure to publish. But I realized that I liked those things and reading about what other people found out, conflicting results, the things that affected their study that may make their study valid or not valid, or not even not valid, the problems that they faced, it was kind of the same as yours. So like I wouldn't say that on my own I would have done it. I had a push from my boss, like I said. So he kind of he's pushing everybody literally to go get do some research work. So it's I think that when you're young and you have opportunities to do these things, I think you should immerse yourself in it.
Yeah.
And you try different things and you might like it. Some people just don't want to do it at all. And I mean, you'll never know if you don't try.
So true.
Yeah. And if you try it and you don't like it, so what? You can't like everything.
Yeah, at
But
least
you
you
have to
tried.
try.
And you know.
Yeah. And the whole thing about 6 years of medicine and it's long, I think that if you truly want to do it, 6 years of your life is nothing compared to doing something that you love like your whole life. So if you truly want to do medicine, I mean, university is 4 years, I think, for some people, 3 years, and you're doing 2 more years. So I don't think that it's such a long journey. It is long, but I mean, you could do 4 years and graduate, or 3 years and graduate, but then you can do, this and then do something that you love for the rest of your life. But if you don't want it bad enough, then I mean, 6 years is a long time. So
it's a sacrifice. And sacrifices pay off, but they do require some
discipline.
Loads of discipline, yeah.
A lot of discipline. I mean, there's in the Czech Republic that their system is quite different, but I think that it all like you have to, even if you have to do self-study or you have the notes and everything, it's all discipline. It's all sitting down and saying that I have to do this and connect the dots when it comes to, the clinical aspect of medicine, not just a theory part. So I think that 6 years is just a drop in the bucket if you love it and you want to do it. So it's not too long that it's like, I mean, there are many doctors worldwide and they've been through it. So
yeah.
What
is a typical day like for you in cardiac surgery?
When I'm in surgery, it's how do I prep for surgery? Well, I'm Christian, so I pray before surgery. But we usually have to start really early, go into the hospital. We have morning meetings at 7:10, and then we go into surgery, depending on the procedure. And that's why, like I said, with cardiac surgery, you sometimes don't know what to expect, because a patient, like you say, oh, it's the same valve you're replacing. It's, but the patient's anatomy could make things interesting. So it depends on the surgery. So the minimum or the least amount of time you can spend in surgery is 3 hours.
Oh my gosh.
Or maybe 2 hours something. But that is because for us, if we have to do a valve surgery, we are going on pump, and then we have to wean the patient off. So the minimum is 2.5 hours or 3 hours, and it could go as long as 10 hours.
Oh my gosh.
Depending on what surgery it is.
Oh my God.
I don't drink too much before surgery, because then you cannot go pee. You have to be sterile. And so I don't drink too much before surgery. I do have breakfast, but I don't have too many fluids because you can't just go and come as you please. So we prep for surgery. You go in around 7:30, 7:45, and depending on, how long the surgery goes, you stay in there. You get breaks for lunch, maybe sometimes. Sometimes you don't, you just keep going. But typically, work finishes at officially at 3:30. But if you finish early, you could go earlier. If you don't, you stay on. So some days, that's why there's a balance. Some days you stay 10 hours, some days you can leave around 2.
And what time
But
do you come in?
Sorry?
What time do you come in?
At 7.
7.
You are supposed to be at work, starts at 7. So you get that 6 something. And then at 7:10, you go in for your morning meeting. And then, if you're in the ward, you're in the ward. If you're in surgery, you go in and, scrub up. It depends on, and most of the time, the residents are allowed to start the procedure. And then the consultant comes in if there's like a difficulty, and then he takes over, and then we swap. But typically a surgery would take, most of the time, you are usually not in short surgeries unless it's one valve or something. And you always go on pump when it's a valve surgery, when it's a bypass most of the time. So work typically starts at 7 and then ends at 3:30. But if you finish early, you can leave, early. And most of the time you can finish on time, and then you go. If you're on call, then you are on call till 7 a.m. the next day. If you have to stay 24 hours, which I don't do yet, you start at 7 and you finish at 7:30 the next morning. So it's quite flexible. I think that the system and the check allows you to sort of have a life. If you are not on call, you start at 7, you finish at 3, then the rest of the day is yours. This is why I don't understand the concept of, surgery is woman-based, especially in this country. It's a male-based, field, because when you finish at 3:30, you have the entire afternoon and evening to yourself, so you can, have a life. And me, typically, when I finish with work, I go try and work out, and then I come home. So there is a work-life balance. If you can have a life if you want to have a life. And if you don't, I mean, you'll finish work and think about work. So yeah.
I think medicine and just work in general, whatever field, is very different Eastern Europe compared to maybe the UK or America, because you guys start around 7 a.m. and you finish around 3. We typically start around, just any job, work life typically starts around 9 and finishes around 5. And for doctors, it's typically, depending on which hospital you are, I've had hospital placements that I've done where they do short days, which is like 8 a.m. to 6 p.m, and long days, which is 8 a.m. to 8 p.m. And I heard in America, they will work you hard.
They
like
have a
the
system
ground.
that go.
Yeah, but then the training is typically shorter for a lot of the speciality. So everything comes with its own like pros and cons. But I will say one of the things that I like the most in terms of European countries is the work time scheduling, because you can have time to do anything afterwards.
Anything you want to do, yeah. So my boss actually told me that in the US, the cardiac surgery centers, so in the hospitals generally, they work in teams. And if you work in teams, the residents are on call 24 hours a day, 7 days a week.
Wow.
So you have your team has your patients, and whatever goes wrong with your patient, you are responsible for. So there is nothing like today I'm on call, tomorrow I'm not on call, today I'm off, tomorrow I'm not. You have your patients, and your patients are your responsibility. But the thing with our hospital, or in the Czech Republic especially, the patients that come in is everyone's responsibility. So whoever is on call that day, and whoever is doing night shift that day, it's their responsibility. So you can't, in one way, it's a good thing, because then you know about all the patients. But on another side, like if you work in teams, then you get to follow a patient, the course of the patient's treatment from start to end. And so you can say everything about that patient or whatever, and you know everything that, like, if the nurse says that there's something wrong, you know exactly what she's talking about. But then again, you don't get free time. So
So,
yes, so
yeah,
it's
everything
a
comes
little
with it.
bit, yeah.
What would you say is the bread and butter of cardiosurgery? So what cases do you see and what diagnosis do you see the most often?
Okay, so we usually have ischemic heart diseases. So not exactly myocardial infarctions, but like, you know, angina symptoms that require planned surgery. So not infarctions that need to be rushed into surgery. And also, I would say for the valve surgeries, the aortic valve stenosis. So we do a lot of aortic valve replacements, isolated aortic valve replacements, or isolated bypasses. But in the recent times, we've seen combined, you know, comorbidities that require combined surgeries. So I would say more like revascularization, myocardial revascularizations, and also aortic valve surgeries.
Mm.
But in recent times, I think that the numbers are just, you know, kind of leveling out in terms of combined procedures. So I wouldn't say it's the bread and butter per se, but we see more cases of that. And I don't want to say mitral valve surgeries, but there could be a combination of different kind of surgeries that we do at one time.
Yeah.
So I'll say more aortic valve surgeries and also bypass surgeries.
You
Yeah.
I was speak on one of these talks, it was with a GP, and she said that it depends on the seasons. So in winter they get a lot of colds, for instance, or
Right,
COVID,
right.
whereas summer it's something completely different, more UTIs and all of that. Is
Yeah.
it the same in cardiosurgery, or is it quite constant throughout the year?
I would say it is constant, but I will say one thing about summer is that more people move around in summer. And so um we have had a lot of acute revascularizations in summer because in winter it's like everyone is kind of hibernating and keeping warm. But in summer, people are moving around. So if you're moving around and you have ischemic heart disease, then it's more pronounced because you're doing more physical activities,
Mm.
and then your heart requires more oxygen. And
Mm.
if there's a blockage, then you start manifesting symptoms. So in summer, people move around a lot, and there's more myocardial infarctions, and therefore there's more acute surgeries for bypasses.
Yeah.
And then if we do an echo and somehow we find out that you have an aortic valve stenosis or a mitral valve regurgitation, then we do a combined procedure. But I think that like in summer, we see more acute revascularizations
Yeah.
in the
Interesting.
summer because people move around a lot. Yeah, and people don't like being on call or doing 24 hours in summer because people are moving around a lot. So planned surgeries are reduced in summer because people, if it's a planned procedure, and they ask, can I do it in fall? And we go like, okay, yes, you can do it. We can schedule you for fall. They're like, okay, but then planned surgeries are reduced in summer, but acute revascularizations are more in the summer because people move around a lot and are doing so many more activities. And so any hidden, you know, ischemic heart diseases are like pronounced in summer.
Yeah.
At least in the Czech. I don't know about the other places, but in the Czech, that's
Interesting. It makes
yeah,
sense. It's quite interesting to follow the pathophysiology as to the
yeah,
cases that you're seeing
yeah.
day. So, in terms of hours, how many hours would you say you work a week?
I would say an average of 6 hours a week.
You work 6 hours a week.
About 6 hours. No, no, 6 hours a day. So in a week it's about 30. But then when I'm on call and I go in and surgery goes like it depends on how many how many on calls I have that week and how long I have to stay afterwards. So I would say in an average of 6 hours a day and then 30, about 30-ish.
Mm.
Because we don't have to stay for the whole 8 hours if we don't have to.
Mm.
If you finish, if there's nothing to do in the night, the person who's on night shift comes in, then they free you after like 6 hours
Mm.
or 7 hours. So you don't do the entire 8 hours. So
Wow,
I would
that's
say,
pretty good.
yeah, but some of them are mean. So they'll just be like, yeah, you have to wait.
Yeah.
Yeah, just in case something appears and then they don't have to do it, because most people don't like doing admissions.
Yeah.
So yeah. So
And in terms of finances, how would you say cardio surgery ranks with all of the specialties?
I mean,
Like
after
highly or in the middle? I mean, roughly.
highly, highly, but the problem is that most of the doctors in cardiac surgery, in other surgical fields, they're comparing their salaries to other countries.
Mm.
So it is up there, but they're saying, but these people in this country earn this, but we
Mm.
don't earn as much, that kind of thing.
Mm.
So I would say it's high, but they don't want to accept that. It's high, but in comparison to
Mm.
other countries, they'll be like, yeah, we deserve more.
Yeah. So it's high in
Yeah.
Czech Republic compared to the specialties, but it's not high compared to different countries in cardio surgery.
Yes.
Yeah.
Yeah.
Because in America, they'll pay you filthy. I think,
Yeah.
yeah,
Yeah.
quite well. Yeah.
But they for some reason these people, like, they think that, no, I have a family, and
Mm.
and why should I earn this and that? I think that it's the feeling of the effort I'm putting in is not proportionate to the money I'm getting, because they're saying, did I go off?
No, no, you're still
Okay. So they're thinking that the effort is not proportionate to what they're getting.
there.
So they're saying, okay, so why is this specialization getting this when I put in more effort, kind of thing? But I mean, you chose it, so
Yeah.
yeah.
Do you feel well compensated for your job?
I feel well compensated. I mean, we all want more money anyway,
Of
but
course. No one would turn it down.
yeah, I wouldn't turn down more money, but I think that it's enough.
Yeah.
I think that it's enough. I think that if you love what you're doing, and you have enough, you're not looking for extra, or you're not disgruntled. You're content with what you're having. So I would say it's enough. And as you know that as you rise up the ranks, you earn more, and it depends on your needs as well. So if you're extravagant, then you need more. If you're not, then it's quite okay.
Yeah.
I mean, everyone has these guilty pleasures, but I mean, if you're not buying cars as a hobby, as some surgeons do,
Mm.
like in other countries, then you earn pretty decent amount.
Yeah.
Yeah.
Awesome. Well, thank you so much. I think the recording is about to end because the Zoom session is. But thank you so much for sharing your insight on working in cardio surgery. Is there anything you wanted to say?
Um,